Hi, Blood Talk fams. Welcome back to today's video. We'll dive into key concepts related to platelet functions, aggregations, and disorder, addressing important questions like what caused biphasic aggregations curve, how certain medications affecting platelet functions, and what happened in storage pool diseases. Let's break down the complex topics into easy to understand explanations. Let's get started. In platelet aggregation study, some agent cause a biphasic curve. What does the second phase of aggregations relate to? C. Release of endogenous ADP. In platelets aggregation study, some aggregations agents such as ADP, collagens, and thrombins produce a biphasic aggregation curve. The second phase of the curve is directly associated with the release of endogenous ADP from the platelet themselves. Here's why. In phase 1, initial aggregations, when an aggregating agent is added, platelet initially aggregate rapidly. This is a response to immediate activations of platelet receptors. Phase 2, secondary aggregations. After initial aggregations, the curve typically shows a second phase of aggregation, which is slow and more sustained. This secondary phase occurs because platelets release endogenous ADP and other substrate from their dense granulars. The release ADP then activates neighboring platelets, promoting further aggregations and reinforcing the platelet plug. Why the other options are incorrect? A. Formations of fibrin. Fibrin formations is part of coagulation cascades and occur later in the hemostatic process. After platelets has aggregate and activate clotting factors, it's not directly related to the second phase of platelet aggregations. B. Changes in platelet shape. Platelet shape change in an early even in the platelet activations, but it does not directly explain the second phase of aggregations. Shape change occur as platelet becomes activated, but the release of ADP from platelet is what primarily drives the second phase of aggregations. D. Release of platelet factors 3. Platelet factor 3 refer to phospholipid surface exposed on activated platelet that is essential for the activations of clotting factor, particularly in the coagulations cascade. It is important for clotting formations, but is not directly associated with the second phase of platelet aggregations. Conclusions. The second phase of platelet aggregation is primarily associated with the release of endogenous ADP, which further activates nearby platelets and promote continuous aggregations, leading to formations of stable platelet plug. What therapeutic agents affect platelet functions? The answer is A. Aspirins. Aspirins, therapeutic agents that directly affect platelet functions by inhibiting platelet aggregations. Here how's it work. Aspirin inhibit cyclooxygenase 1, an enzyme in platelet that's responsible for producing thrombosin A2. Thrombosin A2 is a chemical that promotes platelet activations and aggregations or clumping. By inhibiting cyclooxygenase 1 and reducing thrombosins A2 productions, aspirin reduces platelet functions, preventing platelet from sticking together and forming clot. Now, let's review the other options. B. Coumadin, also known as warfarin. Coumadin is an anticoagulant, but it doesn't directly affecting platelet functions. Instead, it inhibits the synthesis of clotting factor, like factor 2, 7, 9, and 10, in the liver by interfering with vitamin K. This reduces the blood ability to form a clot, but it doesn't directly impact on how platelets work. C. Heparin. Heparin is also an anticoagulant, but it works by enhancing the activity of antithrombin 3, which inactivates several clotting factors, particularly thrombins and factor 10A. Heparin prevents clotting formations, but it does not directly interfere with platelets aggregations or formation. D. Streptokinase. Streptokinase is a thrombolytic agent, which means it works to break down existing blood clot by converting plasminogen into plasmin, the enzyme that dissolves fibrin in clots. Streptokinase does not affect platelet function directly. Instead, it helps to dissolve clots that have already been formed. Conclusions. Aspirin is the only agent listed that directly affects platelet functions by preventing platelet aggregations, making it the correct choice. What substrate released by endothelial cells inhibits platelet aggregations? The correct answer is B. Prostacyclin is a protein inhibited by platelet aggregations and is released by endothelial cells, the cell that line blood vessels. Here, how it works. Prostacyclin acts by binding to platelet receptors and activating an enzyme called adenylyl cyclase, which increase the level of cyclin AMP inside the platelet. This increase in CAMP inhibit platelets activations and aggregations, preventing platelet from clumping together and forming clot. Prostacyclin helps to maintain blood flows and prevent excessive clotting, which is crucial for normal vessel functions. Why the other options are incorrect? A. Epinephrine. Epinephrine is a hormone and neurotransmitter that can stimulate platelets aggregations, not inhibit it. It binds to receptor on platelets, leading to activations and aggregations, the opposite of what we're looking for in these questions. C. Ristocidin. Ristocidin is antibiotic that is used in laboratory to induce platelet aggregations. It indirectly activates platelet by enhancing the interactions between warfarin factor and platelet. It does not inhibit platelet aggregations. Instead, it causes platelets to aggregate in testing setting. D. Thromboxane A2. Thromboxane is actually a protein promoter of platelet aggregations. It is produced by activated platelets and acts to enhance platelet aggregations and vasoconstriction. It works in the opposite directions of prostacyclin. Summary. Prostacyclin is the correct answer because it is a protein inhibitor of platelet aggregations released by endothelial cells to prevent excessive clotting and help maintain normal blood flow. In storage pool disease, platelet mainly lack. The answer is A. What is storage pool disease? Storage pool disease of platelets refer to a group of rare inherited bleeding disorders that affect the platelet granules, which are essentials for platelet functions. These granules store various substances that platelet release when activated during the clotting process. In storage pool disease, this is an abnormal in the storage and release of these substances from the platelet granules, leading to impaired platelet activations and aggregations. As a result, individuals with storage pool disease may experience bleeding problems because their platelets cannot function as effectively to form a clot. Types of storage pool disease. There are two main types of platelet granules involved in storage pool disease. 1. Alpha granules. These granules contain proteins such as fibrinogens, warfarin factor, platelet-derived growth factor, and other proteins that play a role in platelet aggregations and wound healing. In storage pool diseases, the alpha granulus may be absent, defective, or contain abnormal contents. Dense granulus. These granules store molecules like ADP, calcium, serotonin, and other molecules that are important for platelet activations and aggregations. In dense granular stored pool disease, these may be reduced number of the dense granules or abnormal release of these stored content. Common stored pool disease, Gasman thrombocytopenia. Although primarily a defect in platelet membrane glycoprotein receptor, it is sometimes considered along with stored pool disease because platelet in these conditions can also inhibit abnormality in granular release. Delta storage pool disease, also known as dense granular storage pool deficiency. This is the most common form of storage pool disease. It is caused by a deficiency or dysfunctions of dense granules in platelets, which impair platelet aggregations. Affected individuals may have reduced platelet release of ADP, serotonin, and calcium, leading to abnormal platelet functions. Alpha storage pool disease, also called alpha granular storage pool disease. This disorder is characterized by deficiency or absence alpha granule in platelets. As a result, platelet cannot release certain growth factor and other proteins that are important for clot stabilization and wound healing. Summary: stored pool disease are a group of platelet disorder where there are defects in granules that platelets use to release substance essentials for clot formations. These diseases can lead to bleeding problems because the platelet can't effectively release the necessary chemicals to form stable clots. Treatment is primarily aimed at managing symptoms and preventing bleeding. In short, storage pool disease is a condition where platelets can't release the chemicals they need to work properly. Platelets have special storage container inside them called granules that hold this chemical. When there are cuts or injury, platelets normally release this chemical to help them stick together and form clot. In storage pool diseases, these storage containers are either missing, deficient, or don't work right. As a result, the platelet can't release the necessary chemicals, making it harder for them to form clot. This can lead to excessive bleeding or bruising, even though the number of platelets in the blood may be normal. Key point: problems. Platelet can't release the chemical they need to stop bleeding. The cause: issues with platelet granules or storage container inside platelet. Symptoms: easy bruising, excessive bleeding, long bleeding times, especially after injury or surgery. Treatments: there are no cure at this point, but platelet transfusions or other treatments can help manage bleeding. That's all I have for today. Did I miss anything? If you have any question, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time changes, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!